Morning, Red.
Scarlett, do anything good last night?
I went to a public debate about the proposals to run a new bypass through the Greenbelt west of town.
Lovely. I cooked a Jamie recipe, we read the guidelines on good clinical ward practice, and watched When Harry Met Sally. Again. Alone. And yet your life sounds sadder than mine.
You are about to debut on my blog. Miss Scarlett, out of Scrubs.
No, I hate that picture. Take another one.
No, the peoples needs to see the NHS like it is. Bad hair day and all, Red.
Scarlett.
Mary, you seen Annie this morning?
No.
Annie? Annie! Annie! Oh my God. Annie? Annie? Annie!
Good morning, Obi-Wan. We are ready to be mentored, yeah?
Well, I've just been looking at your charts to see what you haven't been assessed on yet. And, oh, look, it says here, staff nurse CK hasn't tried inserting a catheter yet. People 6, elderly gentleman in retention. Staff nurse Conway, if you could make sure all the commodes and the bedpans are clean, that'd be great. Lloyd, with me, please.
Thanks. Yeah, she's in here. She's had a lot then. Is she gonna be all right?
We'll find out in a minute, sweetheart. What's her name?
Annie.
Annie, can you hear me? Annie?
Do you live here?
No, I'm a friend. She lives on her own with a baby.
Check your blood pressure, Annie, okay?
You know what happened?
No, I spoke to her last night. She was fine. We were gonna go out for the day with Evie.
Is this Evie?
Yeah.
Annie's baby?
Yeah, she usually has to sleep about now.
Has she taken anything?
No, not that I know of.
Come on, Annie. You're going to wake up for me. Okay, we've got BP 120/90, pulse 110, GCS 12.
Let's take her in.
Fiona! B! Fiona! You awake? Happy birthday. Come on. Breakfast ready. Come on, you. Time to get up.
Anything like this ever happened to you before?
Not that I know of.
Okay, no obvious head injury, just seems to have some facial weakness. Has she complained of a blow to the head recently or any headaches?
No, not to me.
Anything that you know of in a
Everyone's
medical
got a
history
bid.
that could explain this?
No?
I mean,
One,
does she
two,
normally
three.
drink heavily?
No, Annie's clean living.
Okay, I'll need routine bloods, FBC, UNE, LFT, CRG, and cultures. Linda, an ECG, please. And can you find out the waiting time on a CT scan?
Is it serious? It sounds serious.
Could you wait outside? I'll come and speak to
Come
you
with me,
shortly.
sweetheart. Let's get you a coffee.
Can you hang up a litre of saline?
Oh, happy birthday, darling. Here you go. Open your present.
Thanks, Mum.
Oh, it's lovely.
I kept the receipt in case it didn't fit.
I'm sure it'll be fine. It's just that you lost a bit of weight recently, so I had to get you a smaller size. Ta-da! There you go. Eat up. So, here's the plan. We're going to start off by getting a proper breakfast at that nice place on Brockwell Street. And then we're going to have our hair done and then hit the shops. And I've got us booked into a spa this afternoon. And tonight, I've got us a table booked at that nice Italian restaurant that you like. You okay?
It's Chloe, isn't it?
Yeah.
Okay, well, we're just waiting for Annie's test results. I'm afraid she might be here for some time. Do you know what childcare provision she has?
Yeah, you're looking at it. I'm Evie's godmum. Well, she's with Mary, the next door neighbour at the moment. She's babysits regular, so she's tops.
Dr. Winters, there's a slot available now for that CT scan.
Okay. Mac, could you take Miss McLean and Reese's through to X-ray?
Right, do well.
Oh, this is Richie. Fell over the skate park. He's got a fractured right wrist. BP's 120/80, pulse 90. He's had 5 of morphine and Entonox. He's got good feeling and circulation in his fingers now as well.
Yeah, let's get him in that cubicle there, please, Dixie. You're looking pretty hench, mate. Is that what you'd say?
Scarlett, with me on this, please.
Aye, mentoring the pretty ones first, are we?
No, I just thought you could help translate when you try your teen speak thing.
Slide over for me, mate. Nice and easy.
Hey, there you go, lad.
Okay, well done. Thanks, Dix.
Cheers, guys. Thank you. Right, Richie. I'm Lenny. I'll be one of the doctors. This is Jay, Scarlett.
You alright, mate? What happened to you then?
I fell from the top of the pole.
Oh, aye. What were you trying? 360?
Alright, check you out, Tony Hawk.
How's your pain? Anything hurting other than your wrist?
No.
No? Okay. Still feeling that okay?
Yeah.
Yeah? Okay, let's take a look. Oh, yeah. You got some clear deformity there, mate. I think we should get that wrist x-rayed just to see what the damage is. Let's get it wrapped up again. You know, you boys get street names, don't you? What's yours?
Hamer.
Hamer.
It's actually supposed to be hammer, but I'm not dyslexic, so I spelled my tail wrong.
Has someone called your parents?
Yeah.
Do you know what? I'd be Lionheart. Lenny the Lions.
Yeah, that's good, mate.
Tell you something, I've not had a shot on one of them for ages. Here we go.
Now turn around, come back quicker.
Done it, done it. Oh, smooth. Smooth.
Serve you right. Mate, don't worry about it. Staff Nurse Conway's well impressed.
Jim Levy. I'm looking for my son, Richie. He's had an accident.
Oh. Hi there, Mr. Levy. I'm Richie's doctor. I'm Lenny. We suspect he's broken his wrist, but we're going to take him up for an x-ray just in case. So, I'll show you to his cubicle. Now, he's had some pain medication, so he might be a little bit woozy, but otherwise he's doing great. Okay? Here's your dad.
Sorry, Dad.
Yeah, it's all right, son.
I'll get a porter along in a second, all right?
Hello, Annie. Right, let's see if we can find you a nice, quiet corner, shall we?
Annie! Oh, love, how you feeling?
Where's Evie?
Evie is with Mary, taking her next door. Paramedics saw her when they came for you. She's fine. What happened?
Annie McLean's records. She's been on methadone for 12 months.
She's on a drug treatment program.
Cleared all tests so far. The last one was shortly after her baby was born.
Okay, and did her bloods come back yet?
High white cell count and raised CRP.
Which would suggest inflammation or infection of some kind. Dilated pupils are the exact opposite of what we'd expect if she was using again or if she'd taken a methadone. And we're going to need to wait for the scan results to know more.
She's going to be all right, isn't she?
Oh, yes, of course she will. You two will be out and about with your boyfriends in no time.
Boyfriend.
We call Mary and make sure Evie's okay.
So you're not spoken for, then?
Matter of fact, we're not, mate. So maybe you could find us a nice couple of doctors while we're here.
I'll do my best.
Annie, hi. I'm Dr. Winters. I treated you earlier. Can you tell me what happened?
I don't remember. I just got Evie to sleep.
Okay, Annie, can you raise your arms for me?
Babe, just lift your arms up.
Oh, I feel sick. She's dropped her pulse and pressure.
Right, we need to go straight to resus. Can we get some help here, please? 17, I feel so old.
You've got your whole life ahead of you, Fee, you know that. You've just got to get better first.
I know. I will.
Have you thought any more about it?
Yeah, I just need to be a bit happier first.
So, what about a boyfriend? Have you seen anyone?
Mum.
What? You know you can talk to me about that stuff.
Can I go to the bathroom now?
Not yet. You've got to get something to eat first.
It's a fast progressing muscle weakness. I mean, cranial and peripheral nerves to limbs were fine earlier. Now, I need to find out more about a history of drug abuse. You didn't tell us that Annie was in a drug treatment program.
No, because I didn't think it mattered. We've been clean a year.
Oh, you were on the program together?
Yeah, at the clinic here. Annie, well, she went on the methadone because she was pregnant. And I tried it, lapsed, so they stuck me on the diamorphine.
They went ahead with their drugs clinic then? Yeah, it's on trial. Charlie runs it.
Actually, I'm due a dosage. Do you mind if I...
That's fine.
I need a doctor.
You've come to the right place. Oh, okay. Can I get some help here, please?
Okay, this way, mister.
Gillings. Chris Gillings. I think I have food poisoning.
Oi!
Oh, thank you. Here. Cheers. Keep change, thanks. Feel better now?
Thanks, Mum. It was a lovely breakfast.
Right. Well, we'll go and have our hair done, and then we'll go shop.
Let's get you on the bed. Mr. Gillings, this is Dylan, one of the doctors.
I ate some dodgy prawns last night. Down in a seafood restaurant in Edwalton. J. Shaw's.
All right. Any reaction to shellfish before?
No.
He's tachycardic.
Burning up a bit. How was Shaw's? Apart from the whole they might have poisoned you thing. All right, keep still. You have much to drink?
Just worried. A bottle.
And I'm not much of a playboy, but if Sister Bateman here were to take pity on me, for example, wouldn't want to poison her on the first date.
38.1.
Oh, that's warmish. Any diarrhea, Chris?
That too.
Okay, let's get a drip up, routine bloods and a stool sample. I'm going to keep you in for observation. Just try to relax, let it come out by whatever means. I'll leave Mr. Gillings with you, sister.
Hey. No, I can't. I'm shopping with my mum. No, I can't tonight. I'm busy. Yeah. You know what? I'll give you a call later, okay?
We can't fit us in for a manicure for another hour, so fancy grabbing a coffee?
Yeah, I could do with sitting down.
You okay?
Yeah.
Let's find a cafe then. So, who was that on the phone?
Just a friend. Just wish him happy birthday.
Oh, that's nice. Which one?
Phil. He said he's got a birthday present for me as well.
Phil? How can he afford that? If he's got a present for you, you can bring it round the house when I'm there, okay?
Yeah, I know, Mum.
Good. That top's going to look gorgeous. Then we've just got to get you a coat and then we'll be finished.
Fiona! Fiona! Help! Somebody help me!
Okay, got your x-rays back, mate. You got a badly displaced fracture of a distal radius and ulna with significant dorsal angulation. Okay, in short, you've buggered your wrist right up. We can, however, fix it.
Mum. I came as soon as I got Dad's message.
Sorry, Doctor, go on.
No, it's fine. I'm saying we can, however, fix it, but you're going to need an operation.
Will I have scars?
I'm afraid so.
Cool.
Let's have a look.
Right, well, I've referred you to the orthopaedic surgeons. They're going to come take a look at you, and then the anaesthetist will want to talk you through what he's going to do, okay?
It's a bit sore. We'll clean it up for you.
It's Fiona Reardon, 17, took a tumble in town. KO briefly for about 30 seconds. GCS was 14 when we got there. BP was 110 over 90. Pulse 80 and SATs at 97%. Got a nasty deep cut on the back of her head.
Okay, let's get her across.
All right, when you're ready, please. Everybody got some?
Yeah.
1, 3. 1, 2, 3.
This is Fiona's mum, Jane. Is she going to be okay?
Tell me what happened.
I don't know. She just fell down the stairs.
Fiona, can you hear me?
It's a birthday as well. She's only 17.
People so reactive, that's good. Fiona, can you hear me?
I'm here, darling. It's okay. Let the doctors look at you.
Heart rate 82.
Okay, let's get some fluids up and I want bloods, FBC, U and E, glucose group and save.
I know you're giving me a right fright.
Okay, nice deep breaths from me, Fiona.
You must have slipped on something.
Good. And can you keep an eye on oxygen sats?
Right, let's get ready to log roller. You're doing brilliantly, darling.
Cool. X-ray, I want portable film from chest and pelvis, then we'll go for a CT. Okay.
Let's just get this on. Sudden onset respiratory problems, staccato of speech.
Come on, Tris.
His BP.
You sure you've never had a reaction like this before? What about family members?
Oxygen saturation 90% and falling.
So no freckling, no heart murmurs. This is odd. His chest sounds clear, his lungs are normal, but his breathing's off. All right, let's get him to resus.
So, this operation, it would be a general anaesthetic, right?
Yeah.
Do you do tests first to make sure there's no allergies to anaesthetic?
Well, no. I mean, reactions are extremely rare, so even if there was anything to happen, the anaesthetist would just change up the cocktail of drugs used and perform a thing called a modified rapid sequence induction.
No, of course. You know what you're doing. Sorry. Thank you, Doctor.
Right then, Scarlett's going to clean this up, and I get to mark her for her expertise in wound care.
I'll be back in a few minutes, and I'm just going to go for...
I'll join you.
When you're ready, Staff Nurse Conway.
Thank you, Staff Nurse Foldren.
Can you do me a favour? Can you take a pic of my mobile? I want to show my mates.
Yeah, sure.
There you go.
Yeah, we'll take a pic of you with a pretty nurse, eh? They'll be well impressed. Scarlett, if you could take it, that would be great.
Brilliant. My mates will love that.
Did you do this when you fell?
I don't remember. Suppose so.
There's no dirt in it. What did you land on?
It all happened fast. The bloke, he kind of pushed me down the pool.
Whoa, I thought you just took a spill. Someone pushed you.
Junkie on the rob. We've seen him around. It's just a scratch, innit?
Yeah. I need to talk to Dr. Lyons, okay?
Didn't you make him take his helmet with him this morning? Oh, God. If he'd landed on his head. Do you have to do that?
Can we not do this today, please? We're here for Richie.
Were you thinking of Richie when you fell into bed with her?
Unknown male found collapsed in the street, displaying clear signs of habitual IV drug use. His GCS was 8, his rests are 6. OK, let's get him over. On 3, 1, 2, 3. OK.
Pupils are dilated. OK, can we get his clothes off, please?
Okay, let's get the monitoring on as soon as.
This is Reardon. We need to clear the room for X-ray. Let me take you to the relatives' room. You can wait there.
Is she going to be okay?
Dr. Winters is still assessing, but Fiona took a nasty tumble. There's always the possibility of concussion for one thing. Either way, she's likely to have a nasty headache.
So it's definitely a head injury. There's nothing else wrong with her.
The X-ray and CT scan will tell us for sure, okay?
Thank you.
Could I have a quick word, please? Right, we think Richie might have gotten himself a needle stick injury at the skate park. It was a junkie trying to steal from the kids' bags. That's what caused him to fall in the first place.
So it could have given him an infection?
Well, it doesn't normally develop this fast. We've cleaned out the wound and... All right, look, the greatest risks from a needle stick injury are HIV, hepatitis B and hepatitis C, but the odds are well in Richie's favour. We've taken baseline bloods. I'll make sure that Richie's GP follows up in 3 months' time.
3 months? We have to wait for 3 months?
I'm sorry. If it's any consolation, the junkie would have had to be in a right state for Richie to actually catch in.
Let's get the kidney dish. All right, mate. There you go.
Okay, he's gone into cardiac arrest, PEA. Can we start CPR, please? Get 1 milligram of adrenaline, IV, and another litre of saline, please.
Right. I see you got your fix then.
Sensing your disapproval of my best efforts to turn my life around.
Just because you got the drug and the needle for free doesn't make you not a junkie.
We do all the counselling.
Just turn your head back.
But we had it bad. Working on the streets. You know what I'm saying? Working girls.
I'll just, put,
You're still a little feverish. As you're still no by mouth, I'm going to need you to roll over onto your side, please.
Oh, bad luck, mate.
I'm fine. I really oblige you to take your medicine until we find out exactly what's wrong with you. Just relax. It's only uncomfortable for a little while. What have you done here?
Nothing, it's just a scratch.
Given the amount of drugs which is on, isn't it dangerous to proceed with the operation?
No, it's still critical that we reduce the fracture at the earliest opportunity. If you have specific concerns, then I can have the anaesthetist talk you through it in detail.
Yeah, maybe I should. I just, He's my only child, you know. And with this scratch on his hand, it all seems to be complicated.
Mrs. Levy, if you have information that's germane to Richie's treatment, you really need to tell me.
Richie's father suffers from malignant hyperpyrexia. I understand it's hereditary.
Yeah, 50% of the time, yeah, but that's not a problem. If he does have it, it's not a problem. Theatre can cope. Why didn't you and your husband tell me about this before?
Because Jim's not Richie's father.
Okay.
And he doesn't know.
Okay, thank you.
He's got an output. It's about as healthy as this gentleman's ever likely to be. Well done, everyone. Did we get an ID or next of kin?
They just said no.
Right, unknown male it is.
So, you know, ambulance control have called. They've got 3 similar collapses en route. People seem to be dropping in the streets today.
Okay, this is Larry Foster, 62, works in a bookies, became disorientated.
I've got this.
Slurred speech and breathing difficulties.
I want to know if he went out for dinner last night. The manager says he lives alone, apparently. I think we might be looking at an outbreak.
Dr. Winters, I need to show you something. It's about animal clear. In a moment, Linda.
Can you check in for muscle weakness?
Yes, thank you, Dr. Keogh.
Hello, it's Dr. Keogh here from the emergency department at Holby City Hospital. Hello. I want an honest answer to this question. Have you had any complaints of food poisoning since last night's service? No, I'm not accusing, I'm asking. No, you sure? No one? No? Okay, thank you. Oh, yes, in that case, can I make a reservation, please, for this evening? 8 o'clock. Yeah, Keogh. No, Keogh. No, just for one, unless you accept dogs. No. Okay. All right, thank you. The patient that you wanted to talk to Ruth about, is she one of them?
One of who?
One of our peculiar neurological cases.
Yeah, I found a wound that we didn't know about.
Hello, I'm Dr. Keogh. Very good at fixing people. Roll over, love.
The other doctor was a lot nicer.
Come on, Annie. We're not going to hurt you.
Right. Nurse Thingy, with me, please.
Big on bedside manner, that one, is it?
We're missing something. A lot of today's intakes share a common vector. Right now, we are dealing with different symptoms across a range of patients, and no one has the faintest idea what's wrong with any of them. We need to put our heads together and figure out what we're dealing with. Spread the word.
No, look, I promise you, the chances of you having anything more than just a bit of a bug or slow slim, they're practically anorexic.
So, I can go home tonight? What?
You'll have to stay in tonight, darling, but don't worry, you'll hardly notice. You'll be asleep from anaesthetic.
But it's only lunchtime. Mightn't he recover by this evening? I don't want to clog your beds up.
That's very kind of you noted. Different people react in different ways to anaesthetic. Sometimes it takes longer to recover.
There's not something in Rich's test results, though, that make you think that the operation is going to be complicated, is there?
No. It's all perfectly standard.
What is?
Right, okay, I have reason to believe you may have a condition called hyperpyrexia. It's nothing to worry about, it's nothing dangerous. It just means you might take a bit longer to recover after an operation, and it means that we need to keep an eye on you in case of any potential fevers.
Reason to believe?
It came up in an observation. Here, there is one thing that you guys need to know. In 50% of cases, this can be handed on to the offspring, which means when little Richie boy here hands you to a pair of grandchildren sometime down the line, it's going to be your job to let the paediatricians know about the potential for this condition recurring.
It's hereditary?
Yeah, I mean, like I say, half the time. I mean, it only takes one parent for it to pass on.
But Carol and I don't... Are you sure?
Excuse me, Dr. Lyons. Emergency staff meeting.
Right. I'm really sorry. I'm going to have to go and speak with my colleagues. I'll be right back.
Right.
Okay, we have a problem. This department sees, 200 patients a day, broken limbs, heart attacks, things, stuck up strange orifices. And yet today we have 4 patients admitted and 3 more on the way in, displaying hugely different and yet entirely similar symptoms. My food poisoning comes in with the usual problems. And within an hour, he's experiencing respiratory difficulties and limb weakness. Your Miss McLean?
McLean.
Comes in, looks like a stroke, rallies under treatment, and then she develops another case of muscle weakness. Your run-of-the-mill boy comes off his skateboard, breaks his wrist, dude. He's developed an infection.
Yeah, but I know why.
What about your elderly patient, the one you've just admitted?
Neurological irregularities. He's already gone for a CT.
See, we're burning through the scans today. What do they all have in common? We're looking at a range of ages, socio-economic groups. Hold on. You say you know why?
Yeah. My patient got a needle stick injury. I mean, we've done all the baseline bloods, but, you know, the wound itself got inflamed pretty fast.
Take a look at that wound.
No, it's badly infected. It'll need incision and drainage. How did you get the wound, Annie? I don't remember.
That's the methadone working out for you.
Yeah, great. Yeah, she's really good. I'm proud of her.
Can't be easy, being a single mother.
I think I'm just run down, you know.
Look at me, Annie. Annie, look at me. At me. I've only got a dog. I know how hard that can be. You have to feed them, wash them, make sure that they're looked after if you're going away for too long. And sometimes in the middle of the night they won't sleep. They think they've heard a mouse scratching around. I can only imagine it must be twice as hard.
Dr. Keogh.
You know what I'm getting at.
Annie, have you told us everything we need to know to diagnose your condition? It doesn't mean you're a junkie again. It just means you've had a relapse, and we can help you with that.
It's just been really difficult. Annie, it's a bit easier for you. You're on morphine. I kept clean for Evie, but it's so hard.
You've been ejecting here, right?
Just a couple of times, but it got sore. I don't know, the needle, maybe. It's hard to keep the house clean these days.
What are you doing?
Having an internal monologue about little pricks. I think I've got to the bottom of your condition, Mr. Gillings.
Yeah?
Ah. Why do you inject yourself in the foot? It's normally only long-term junkies who can't find veins elsewhere that do that.
I lost my business. And then my house and wife. I wasn't in a good place. It became a means of survival. Look, I've cut right down. It's only an occasional thing.
It's never only an occasional thing.
My latest intake, elderly man, needle marks all over his arms.
My man's been injecting as well. Oh, that's it. The dilated pupils, that's what threw us off. Clostridium botulinum.
Botulism?
All our patients, some of them are hiding it better than others, but they're intravenous drug users. Their heroin has been infected at source, probably by bacteria in the soil. If you do not know the appropriate treatment, look it up now. Test. Organise blood and stool samples for all suspected cases, and put in a call for emergency supplies of botulinum toxin.
We're heading towards a serious public health emergency, so I'll warn management and check capacity in intensive care.
You'll be fine, darling.
If it is botulism that Richie's picked up from the needle stick, the antitoxin will take care of it in no time. He's going to be out for some hours now, so I need to go and get a cup of tea or something.
No, you're all right.
We want to be here when he wakes.
However long it takes.
Okay.
Still my son. Changes nothing. All this time you knew. And you were so unforgiving when I made the same mistake.
I can't help how I felt.
Nor could I.
So what are we going to do?
For now, Richie needs us. And that's for the future. I don't know, Cal. I don't know. Whatever the living arrangements, I'll always be his dad. I'm going to be here a while. Want to play charades?
He's going to be okay, isn't he?
Come here. In every way, yes.
OK, can you let the mother know? Linda, we need to give Annie McLean her penicillin and metronidazole.
Mrs. Reardon, Fiona's CT scan showed no problems in the skull and no fractures.
Oh, thank God.
She's taking it easy now. It's common with head injuries. Rest is best.
OK. Thanks for letting me know. Is there a chapel in the hospital? I just, you know.
Yeah. I'll show you how to get there.
Just stop it now. Come on, just stop worrying about it. Now you've had Evie, maybe they'll stick you on the diamorphine.
That stuff isn't just handed out like sweets, you know.
Thank you, Stephanus Andrews. OK, we think we've discovered what the problem is. You may be infected with botulism.
Botulism?
You're lucky you only started injecting again a few days ago.
I will need specific tests to confirm the diagnosis, but in the meantime, I'm putting you on antibiotics to treat the infection. You've no allergy to penicillin, right?
What's the matter, babe? What is it?
Evie. I've been breastfeeding Evie. You breastfed your baby while you were injecting?
Well, the bacteria can't be passed on through breast milk, but heroin can.
I don't. Yeah. Just once. Last night, this morning before this happened to me.
Can you let Dr. Keogh know?
Yeah.
Check the neighbours.
Control, this is 3004.
Control receiving.
Yeah, the neighbour's not in. Anna needs to tell us where she might have taken Evie. Local parks, playgroups, shops, cafes. And alert the local plod. We need to find her.
Understood. Control out.
Let's go.
She's spitting.
Oxygen on. Get on the side. OK, come on, Fiona. And draw up 4 milligrams of lorazepam.
Lorazepam, right.
And let X-ray know that she'll need an urgent CT as soon as we stabilise the test.
4 milligrams done.
OK. This cannula's very positional. Okay, good. Right, let's get some suction.
Pulse has dropped to 40, oxygen saturation's 80% and falling. BP unrecordable. Pulse now only 30.
She's very cyanosed. Can you see that? And bradycardic. No, I can't get an output. Anything at the femoral? Right, she's arrested. Let's start CPR. Tess, can you put a bigger line in, please?
Ruth, she's another one.
She's got to be somewhere.
Sorry, I thought you were someone else. Sorry.
Omar! Mary? Mary, hiya. You been brushed this morning? Yeah. Okay, Annie's fine. It's Evie we need to check over, okay? Why? Don't worry, hon. It's nothing you've done at all. It's all right.
Signs of opioid intoxication. She's got pinprick pupils. We need to take her. Alert 18.
Do you want to come with us? Come on.
Hold. No pulse, still PA. Carry on. Can you get some adrenaline standing by?
Scarlett, you can take over after me.
Where's the mother?
She went to the chapel. She's not back yet.
She's had 60 micrograms of naloxone. Made good response, some spontaneous crying. Maintaining respiratory rate and saturations.
Okay, on the bed there, please.
Come on, Fiona. No, I've got nothing. Recommence.
Annie, let the doctors do the job.
Give me a blood sugar, please, Wayne.
Is she okay? Is she okay?
Should have seen this morning. Just, she was sleeping peacefully.
And she was drugged up. There's no way you could have known.
Okay, we'll just shut the front down. Okay, this child appears to be functioning in a normal baby way.
Thank you. Oh, God, thank God. Oh. Thank God.
2 minutes. She still asystolic. Ruth, I think we should stop.
Okay, you're right. Time of death,
14:17. I'll go through all of this with both of you in a little while, but you did really well. Lloyd, can you get some wipes and a clean gown? Let's clean her up before Mum sees her. Scarlett, let's clear away all the equipment.
Nurse? Did you get the x-ray? Can I see Fiona now?
No. I mean, to both.
Well, has she woken up yet?
Mrs. Reardon, I don't know how to...
Sorry.
Fiona's no longer with us.
What do you mean? Has she been transferred somewhere?
No, I mean, there was a problem.
What sort of problem? With the x-ray?
Fiona's... We lost her.
What, she walked out? You have no idea. If she's on the streets on her own, I've been trying to protect her from that.
No, I don't mean... Fiona died. I'm sorry.
What do you mean? What happened?
Fiona started fitting. We tried stabilizing her, but she kept vomiting in the oxygen mask. We ventilated her, performed CPR, did everything we could, but she didn't make it. It looks like she may have been using heroin. I'm sorry.
Okay, start as a CK. Thank you. I'll take over from here. Mrs. I'm sorry, I don't know your name.
Jane Reardon. My daughter's just died.
I'm so sorry, Mrs. Reardon. Let me take you to see her, okay?
I'm sorry, Mrs. Reardon. Is there someone we can call for you?
Never thought it would end like this. A fall down the stairs.
I am sorry. Did you know that Fiona was using heroin?
It's why her father left. He couldn't go. I was looking after her, helping her. It's been 2 years now. But she couldn't have overdosed. She's been with me all day.
Addicts can be very resourceful about finding the means and opportunity to inject.
No. She's been with me all day. I know she didn't overdose. You've made a mistake. You didn't diagnose a condition properly. I'm going to get a solicitor.
We understand you're upset. We believe there's a batch of heroin infected with botulism.
No. The heroin did not kill her. She only had one small fix this morning.
Wait, you knew she injected?
And I know she didn't have any overnight because I make sure her bedroom's secure.
You knew and you didn't tell us.
Staff nurse Conway, can you leave us, please? I've been reducing her fixes. She was getting better.
You supplied her with drugs?
Do you have children? No. Well, my love for my daughter was unconditional. That's how it works. Soon after she started using, she disappeared for a month. If I hadn't have brought her back, helped her, she'd have been on the streets and I was protecting her from all that. It's not wrong, is it? She fell. The heroin didn't kill her. It couldn't have. I was so careful.
Well, the post-mortem will tell us that for sure.
What are you thinking, man?
She took me by surprise.
You don't give a relative that kind of detail. It's not necessary. You have neither the experience nor the seniority to be breaking news to relatives yet. When in doubt, keep your mouth shut and always wait for a senior nurse or a doctor. Now, when she's calmed down, I want you to go and apologise to Mrs. Reardon and hope that she doesn't sue us for unnecessary emotional distress.
There's no way I'm apologising to that woman. She killed her daughter.
We don't know the whole story. She wasn't trying to kill her. She was trying to cure her.
You can't agree with what she did.
Guys, you're getting too emotionally involved. You can't do that.
You're damn straight I'm getting emotionally involved. When I told her daughter had a head injury, she seemed relieved. She was protecting herself by not telling us about the junk. What that woman did was manslaughter.
You know, if you've learned one thing today, learn this. That God, the universe, is determined to kill humans by any and all means necessary. You're going to see that at work every day here for the rest of your career. And if you get angry about it, it'll eat you alive. Shift's not over. Get back to work.
I brought you some of these.
Oh, thank you.
Oh, and this. Cool. Oh, they've given you plenty of formula, so you won't need to, well, enough.
So what's your name anyway?
Round here they call me Big Mac.
Big Mac? Well, Big Mac, you've been so lovely to us. Like that. What's she called? Nurse Andrew. She's been a right mardy with me.
Oh, she's not a bad girl. Maybe, she's having a bit of a bad day. Anyway, you're going to be all right, so just make sure you get plenty of rest.
Oh, I'm resting. This is the most restful few hours I've had in months. You know, when I get out, promise me a girls' night in. DVD and takeaway. I can't remember the last time I saw a movie.
I've never been present at a death before.
Me neither. If nothing else, I'm glad we crossed that bridge together.
I don't want these. You're about Fiona's size.
Oh, no, I can't.
Well, I know nurses don't get paid very much.
I just don't think it's...
Thank you. We'll donate them to the hospital charity shop.
So this drug clinic of yours, after today, do you still think it's a good idea to hand out free drugs to junkies?
Yes, more than ever. And it's not drugs, it's medication.
But look what happened. Annie McLean just used us to provide her with enough methadone to see her through a pregnancy, and then she's straight back on the hard stuff.
Look, Annie had a relapse. It's probably due to the pressure of trying to bring up her little girl all on her own. It happens.
Don't bother with the lecture, Charlie. It's self-inflicted sickness.
Annie's learned her lesson. She doesn't need criticism. She needs support from us. Which, by the way, is our job. Thanks.
Evening, ladies.
More meds.
The best medicine of all. Laughter. Pick one. I couldn't get you a takeaway. That's against hospital regulations. However, our vending machine has an excellent choice.
Oh, yeah? This is where the cool kids are hanging out tonight? Oh, yeah.
Oh, yeah, definitely that one.
No,
Come on, you used to...
No. What are you talking
You've
about?
seen that film?
Yes, I have. No, this
I
one.
just wanted to check that you and Evie were comfortable. I can see that you are.
Do you like to hold Evie? Come on.
Let's do it by show of hands. Who wants this one?
Fair enough.
Budge over. Chris, anyone? Hey!